Dr. Abbott is primarily focused on the diagnosis and treatment of patients with kidney stones, particularly large and complex kidney stones. So, Joel, tell me, what exactly is a kidney stone?
Okay, so the first thing I like to describe is just the kidney, right? So the kidney is one of the filters of the blood. Your kidney has two components. Your kidney is like a round piece of meat, and it takes blood from the body. It circulates through the kidney and filters out the blood. Then on the inside of the kidney are hollow drain tubes. That is the backside of that filter, which is, the filtrate, or what's filtered from the blood is the urine. And so the urine is collected on these internal drain tubes of the kidney, which all come together into a funnel and drain down a long, skinny tube down to your bladder. So kidney stones form in those drain tubes. It's basically mineral deposits that can form a little rock and get stuck within the drain tubes, which is why they become so symptomatic and why people complain about them so much. They can be all shapes, sizes, colors.
Okay, okay. Now, I've heard anecdotally that kidney stones are the second most painful experience a human being can have after childbirth. So, you know, are they painful? Is it exaggerated? Like, what's like? Are they truly this painful?
Yeah, being somebody that treats them every day and see. So luckily, I've never had a kidney stone. Ironically and luckily, I've never had a kidney stone. I've had family members that have had kidney stones, and certainly the majority of my patients have kidney stones. And it is significant pain. Stones can sit in your kidney. So remember, the kidney has the meat part and the collecting drainage system part. And those areas in the kidney, before they get to that drain tube, a kidney stone can sit there for months, years, and never affect you. You might never know it's there. It's not problematic. It doesn't cause any pain. The moment that stone gets stuck into that drainage tube, that's when the symptoms occur. There's two sources of pain. One is that your urine is draining down these tubes into the bladder, and that is now obstructed or blocked by the stone. The secondary pain that you feel with kidney stones is that your ureter, which is the tube that drains the urine down to the bladder, so you've got this little tiny tube where there's a stone inside of it, blocking the flow of urine and simultaneously being squeezed on. And so both can be simultaneously very painful. They can affect you up here in the back as well as down into the front on either side, whichever your stone is on. And they do very often compare to childbirth. I've had many female patients that have told me it's worse than childbirth. I've had female patients that say it's number two, but certainly the patients are very symptomatic. It's definitely a problem.
Let's talk about how do you get kidney stones. So, what is it that we do as as human beings on a day-to-day basis that eventually cause us to get these kidney stones?
Gotcha. So I would say the two big ones are dietary, because things are being filtered out of your blood and pushed into your urine to get it out of the blood. So if you have too much, say, calcium or sodium within your body, sodium's a big one that I see a lot, where your body's very sensitive to sodium. Sodium is responsible for your blood pressure going up and going down, right? Higher sodium brings more fluid into your vasculature, into your veins, and makes your blood pressure go up. Well, your body doesn't like high blood pressure.
So, sodium is salt, right?
Salt, correct.
So high salt intake.
Correct. High salt intake. Your body's very sensitive to it because it wants to regulate the blood pressure. So your body immediately wants to push the salt out of the blood into the kidneys and let you pee it out. Okay. Well, there's a buddy system in the kidneys. The salt can't just get out of the kidney without its buddy. So it grabs its buddy, which is a calcium. So every time a salt is being pushed out of your kidneys, it's pulling a calcium with it. Well, the majority of stones are calcium-based stones. Another big one is dehydration, right? You
I was
need
going
to.
to ask you. I was just about to ask you. I heard that sometimes people say to me, "Hey, you better drink enough water, otherwise you're going to get kidney stones."
Mhm.
So is that a real thing? Like, should we be drinking a lot of water?
Certainly. So it's definitely not a misnomer. And just think about it. I explained these little molecules want to come together and crystallize. So water that sits, it's going to want to start calcifying. And so dilution is one of the best ways to prevent kidney stones, aside from anything else dietary, is just trying to keep yourself well hydrated. The other example for keeping yourself well hydrated is that your kidneys are going to be constantly flushing, flushing, flushing. So we need to constantly be drinking water, keeping that water moving.
So I have another question. I mean, I also understand that, like, for example, sugar is really bad. Just in general, it's bad for your health. Does sugar at all contribute to an increase in the probability of kidney stones?
Not really. So control of diabetes, which is sugar related, and I think that's a very difficult topic, is because everybody associates sugar with diabetes, but really it's breaking down different foods into the simple sugars, such as, apples and pears, and you're like, that's not sugar. Well, it breaks down into sugar, or breads, tortillas, chips, it all breaks down into sugar. So, control of diabetes will certainly help you prevent or reduce your risk of kidney stones, but sugar in itself, no.
So sugar not directly, but indirectly, if it increases your chance of diabetes, with diabetes, there's an increased chance of kidney stone.
Yes.
Is that correct? So it's not a direct cause, but as a result of the diabetes. And then how about the other kind of bad guy in nutrition, which is like gluten? Does gluten in the form of like carbs and like breads and pastas, does that also contribute, or is it also, it turns into sugar and it increases the chance of diabetes, which increases the chances of kidney stones?
Yeah, so not so much. There are things that we try to avoid and reduce, but with diet, I always push for moderation.
That more of a balanced diet.
Absolutely. You don't want to be all one thing, because you're going to put yourself at risk for something.
Let me ask you this. I mean, I think the obvious way to know that you have kidney stones is excruciating pain. But are there any other ways to know that you have, like, are there any other symptoms where you would know that you have a kidney stone and you should go get it treated?
Yeah, so you hit the nail on the head. It's mostly the pain, right? But if you're asking, do you have a kidney stone? Well, as I alluded to before, you can have a kidney stone within the kidney that has not yet blocked the kidney. They can sit there for months, can sit there for years. The only way to really diagnose that is to get some type of an imaging study. An ultrasound is, I tell folks, about 80% accurate. A CT scan is the gold standard. That's what's really going to tell you if you have any calcifications or stones within the kidney. For the person at home that obviously doesn't have an imaging study, what you're going to look for is pain in your back. Pain can radiate to your front on the one side. Pain can radiate down into your groin or your genital region. You can have uh, bladder symptoms, almost like you're having a urinary tract infection. You can have urgency. You can have frequency, um, painful urination, things like that. You can have blood in the urine. If you have pain and blood in the urine, that's almost a telltale sign that you might be passing a stone.
Yeah. Okay. Who would you say is the most risk of getting kidney stones? I mean, for me, when I talk to people, I don't hear a lot of young people getting it. I hear more older people. Is there a demographic of people that are more likely to get kidney stones? Like, who's getting these stones
Yeah, so you're absolutely
as the
right.
majority?
So with age, there's an 8 to 10% risk in your lifetime you will get a stone. So think about, as you progress in age, you're moving along your lifespan, you're going to gain risk, because that lifetime risk, well, now you get more and more years into it, you'll have a higher risk. Most of the time,
So it's not
children,
a direct, sorry, it's not a direct relation to your age. You're just saying it's a probability as more time goes by. So it's not an age thing. So it's not something that, it's not something that because you're older, your risk is higher. Your risk is higher because you've been alive longer.
correct,
It's a right?
correct.
Okay, I understand.
And then there's things that I think we don't really prove it in our studies, but kids tend to play, be outside, drink a lot of water. So I think there is a hydration component with age, where younger folks tend to drink a lot more water than we do in working age, and then even beyond that in retirement, elderly age, people tend to drink less water. Like I said, in a lifetime, you have about an 8 to 10% risk. It is more common in men. You have a 10 to 11% risk in men, and women are about 6 to 7% risk, which has been going up over the last few decades. It used to be that men were about twice as likely to get a kidney stone as women, but the risk for women is definitely climbing more rapidly than the risk of men. Overall risk is growing for everybody, but the risk, women are catching up rapidly. It's about a disparity of about 7 to 10% between women and men now, and it used to be about half, 3 and 6%.
Right. Okay. Okay. So next question. How are kidney stones treated? So someone has gone through excruciating pain, or they've had blood in their urine. They've come to you. How are you treating these stones once you've determined that they're there?
Great question. So, yeah, so there's four basically ways to manage any stone. Uh, as I go through the four options, I go from least invasive to most invasive, but in the same sense, least effective to most effective. Okay. Number one, you can do nothing. You can watch it. You can watch it. If it's a small stone in the tube that's, causing symptoms, instead of just sitting back and watching it, a lot of times we'll do what we call medical expulsion therapy. And that's basically where we tell the patient, drink lots of water, uh, give them a medication that's called tamsulosin or some type of an alpha blocker medication. So those are all different options for medical expulsion therapy, little things we can do or prescribe to try to help the passage time of the stone. But those are not surgical options. Then the other three options are surgical options. One is shockwave lithotripsy, and that's where we put you to sleep. And from the outside, you lay on this device that has a coupler that comes up to your skin and sends a sound wave of energy. We're basically just trying to crush the stone into little pieces that should be passable. The next surgical option would be ureteroscopy. Ureteroscopy requires no incision, but it does require going inside the body. So you go through the urethra, go into that tube with your scope and go up that tube until you identify the location of the stone, whether it be in the tube or whether it be in the kidney itself. And then you can use different instruments like a laser fiber, or there's little devices that are graspers. You can grasp little pieces of the stone and pull them out. And then the final option is a percutaneous option called percutaneous nephrolithotomy, and there's different versions of that based on the size of the incision. And you make a small incision anywhere from, half a centimeter to 2 centimeters, and you make an incision and then pass a scope from above into the kidney, and you're able to pull out larger pieces or do things from above that you can't necessarily do from below. But that obviously requires an incision. You're going through the kidney, more bleeding, more of a surgical procedure.
Right. Okay. So now let's get to the 5 ways to prevent getting kidney stones. What is Joel? What is your advice? What is your medical advice? What are the ways to
How
prevent?
can we prevent?
Yes.
My top recommendations would be number one, we talked about sodium, salt, processed foods, deli meats, restaurant food. We all love eating out. And so the recommendation is to have your salt less than 2,300 milligrams a day. Just know that you need to be very conscientious about how much salt you're intaking. And it's not how much salt you're putting on foods. It's usually how much salt is already there in the foods. Second thing, so citrate is a very important thing for kidney stones because it's the defender against most kidney stones. So what we try to do is get at least 1/2 cup of lemon juice into your water daily. And so if you're drinking, you're hydrating like you're supposed to be, and you're squeezing in or pouring in at least 1/2 cup a day of lemon juice, you're going to increase your citrate level, and then that's going to help defend against calcium's binding with other things that are going to form stones.
So is there any are those the main things? Like, or was there anything else?
So real quick to just add on to citrate, a lot of soda pop drinkers out there, okay? If you're going to drink soda pops, that's fine, but try to drink the soda pops that are clear or, citrus or fruit flavored. Those soda pops are actually carbonated with citric acid as opposed to phosphoric acid. Phosphoric acid is your Coke, your Pepsi, your darker soda pops. So if you're going to drink soda pops, which we No has a lot of sugar and a lot of other problems. Drink the lighter ones. It's going to give you a little source of citrate. I would say recommendation number 3 would be back to what you said, which is drink, drink, drink. You want to get at least 2 to 2.5 liters a day. And then moderation with diet. I think I spoke on it earlier. There's these fads with the diets of the high, and trust me, I want to be in shape. I want to look good. I want to do all that stuff too. But you want to be conscientious of the risks when you go on a protein diet, and you're going to increase your uric acid and lower your pH levels and put you at risk of kidney stones. So really, just be balanced with your diet. Not don't eat out. Just don't eat out every single meal. Don't.
I have a question that I think a lot of people are going to want to know the answer to. So, there's certain vices that a lot of people have, and they're going to want to know if these vices contribute to kidney stones. So, for example, like alcohol. Is alcohol's sugar though, right? Alcohol turns into sugar. So, but does alcohol have any kind of negative effect on the
So
kidney?
I get the questions I get a lot, and you just hit it. Was what about alcohol? What about coffee? There's actually been no studies that show an increased risk with alcohol and coffee or caffeine. That's a misnomer that we've made recommendations on that aren't actually accurate. So drink what you want.
Right.
Just drink.
Okay. Gotcha. Dr. Abbott, thank you very much. Have a great
Thank you
day.
so much for having me.
For more information and to see how you can get in touch with Dr. Abbott, you can check the link in the description box for Pacific West Urology and get in touch with him.